Good evening. My name is Miriam Claudia Graham, and I'm a registered dental hygienist. I got my Associate of Science degree in 1989 from Middle Georgia College, and I got my Associate of Science in Dental Hygiene in 1991 from Macon State College. Ironically, those two colleges merged into a four-year college several years ago, and is now Middle Georgia State University. There is no longer a dental hygiene program at Middle Georgia State. Central Georgia Technical College, which is in Macon, now has the dental hygiene program. I worked in private practice for 26 years for the same dentist. It was a general practice. And I worked there for 4 years while I was in high school and college. So I really was there 30 years before I made a major career move for myself. And in August of last year, 2017, I became an adjunct instructor at Central Georgia Technical College in the hygiene department. So I've had some major career moves. I've enjoyed being with the students, teaching them new things, watching as they learn new things. I'm learning new things because they're using instruments that wasn't even taught when I was in school. But I'm having a real good time being with the students. And I'm also in the bachelor's completion program at Georgia Highlands College and hope to graduate in May with my bachelor's. So it's very good to be here. I want to talk to you today about smokeless tobacco and the effects on the oral cavity. I'm going to give you a little pre-test. It's about 5 minutes. Just put your initials on the test. It's just going to ask you some questions about my topic, and then at the end we'll do a post-test and just see what you've learned. But I just want to get your idea of what you knew on this topic. Does anyone here use smokeless tobacco? Can anyone tell me why you use it or what it does for you? Has anyone ever had a suspicious lesion in their mouth that may have been caused by smokeless tobacco? Has your dentist or hygienist ever tried to get you to quit using smokeless tobacco due to the high risk of oral cancer? These are just some things I want you to consider as we talk about our topic. The goal today is to educate both men and women about the link between smokeless tobacco and oral cancer. You're probably wondering why I chose this topic. Well, I have a husband who is 48 years old and he dips. He dips Copenhagen snuff. It's the moist snuff. Smells bad, doesn't have the wintergreen flavor or anything like that in it. And he says he's been dipping since the 4th grade. So if that's true, he's been dipping for, 40 years? Almost. I do keep a check on him. He does not have any desire to quit. He's addicted to the nicotine, which is what happens with these smokeless tobacco users. And he just feels like he can't live without it. And if he were to quit, we may not be able to live with him, but I do want him to quit. I have told him the dangers. I keep a good check on his mouth. But I want him to also read this material and see this presentation to further educate him, and hopefully maybe the next time I see y'all he will have quit. Fingers crossed. The objectives for the presentation today is we're going to define the 5 uses of smokeless tobacco. We want to identify at least 5 types of oral cancer caused by smokeless tobacco. We want to identify 3 symptoms of oral cancer caused by smokeless tobacco and list 3 of the primary risk factors associated with the use of smokeless tobacco and oral cancer. And we want to describe the link between smokeless tobacco use and oral cancer. So what is smokeless tobacco? Well, it's a tobacco that is chewed or snuffed rather than smoked. It contains more nicotine than cigarettes. It's also called chewing tobacco, dip, oral tobacco, snuff, or spit tobacco. A lot of the Major League Baseball players, they call it spit tobacco. There are different flavors, different kinds. You have the chewing tobacco, which is like the beech nut. It's the long leaf or loose leaf tobacco. You have the Copenhagen or the snuff, like I had said earlier. And they also make them in different flavors. There's long cut, short cut, snuff, wintergreen, beech nut, red man, red supreme, but a lot of flavors to entice the user of reasons to want to use it. I even looked up what smokeless tobacco tastes like, or supposed to taste like. And they described it as really sweet. Almost like they've compared it to gum. So the user thinks it tastes really well. There are many uses of smokeless tobacco, but tobacco is one of the major cash crops among American farmers. The annual production is around 700 million kilograms, and this country ranks 3rd in the world population after China and Brazil. The farmers here in Dodge County, where I live, this is a small rural area, they grow tobacco. When I was a little girl, I was friends with a girl whose dad was a farmer. And we were playing one day, playing hide and seek, so we ran in this metal building, and it had things hanging on it, on the inside. Not a lot, but it was kind of like dead crops. I didn't know what it was. And later I asked her, I said, what are we in? What are we playing in? And she said, a tobacco barn. So I have played in a tobacco barn. Never knew what one was until then. Haven't been in one since. Don't plan on being in one anymore. But it's a major cash crop with the farmers. And it can be used for the smokeless tobacco as well as for cigarettes. So the farmers sell it and all over the world to make their profits. The early uses of smokeless tobacco, people thought it was to purify the mind, heal the body, relieve pain or like of a toothache, relieve constipation, treat skin disorders, head lice, hemorrhoids, snake bites, ringworms, and even bee stings. And a lot of people still use the tobacco for bee stings today. When I was a little girl, and even as an adult, when I would get stung by a bee, first thing somebody said is, where's some tobacco? Put some tobacco on it. If they didn't have some smokeless tobacco, they took a cigarette, would unwrap the cigarette, get the tobacco out, moisten it with their saliva, and put it on the bee sting. And that was supposed to help take away the pain. So it has a lot of medicinal purposes, or at least that's what people seem to think that tobacco was used for. In 2017, the current use of smokeless tobacco in high school students, the overall was 5.5%. And you're talking 9th through 12th graders across the United States, 5% of the high school students are using smokeless tobacco. Therefore, probably half of those are already to the point that they're addicted. Out of those 5%, 7.7% of those were males and 3% were females. So it is very common among females. You may remember years ago seeing some older women. I remember a great grandma that would use the snuff. So it is really common. You can't just say it's something that guys will do, because it's not. In 1994, according to the New York Times, the Skoal Long Cut Wintergreen was the type of moist snuff made by the United States Tobacco Company that had the highest level of nicotine out of 11 brands that they analyzed. 3.35% of the total dry weight was nicotine. So these little cans are packed with nicotine. Athletes, pro athletes, especially Major League Baseball players, they really influence these high school students to use smokeless tobacco. Not that they're in advertisements or anything like that, but you see them on TV. I remember my favorite team, the Atlanta Braves. I was watching as Greg Maddux was in the dugout one game. He wasn't pitching, and he had a upper lip dip. And so he had his snuff up under his upper lip. So his upper lip really bulged out. And the camera kept going to him in the dugout, so it was impossible not to see it. But they don't realize how influential they are to the younger generation, and how the younger generation looks up to them as their hero. They see them spitting, they see them having the tobacco, they want to be like them. Smokeless tobacco is consumed as snuff, dipping form. They even make it in pouches, or the chewing tobacco long leaf. This is the chewing tobacco or leaf tobacco. I don't have any in the pouches, but the pouches has this snuff in tiny pouches, like in the picture on the bottom left, and you just put the pouch wherever you want the tobacco to go. So it does kind of stay all together. When you pull it out, it's not all in your teeth like snuff is, because it's contained in that pouch, but it still has just as much nicotine, and that's one of the most common. The pouch is one of the most common among the women. I've seen women use those pouches, and I guess they think it's concealed a little better, being in the pouches, that somebody couldn't see the black tobacco in their mouth. The uses of smokeless tobacco, we talked about the early uses. It's also used to relieve stress, relieve depression, relieve emotional and physiological changes. And I think about my husband when I think about this. When he wakes up in the morning, he's got to have that nicotine. But during the day, he owns his own business, so I've seen him if he gets stressed out, he's got to have that nicotine. And it does just kind of calm him down somewhat. But I think a lot of times it's a mental thing that they think they've got to have it to calm down. before I talk about the oral cancer, I was going to tell you, there was Chris Ledoux, a country music singer, sang a song about Copenhagen. And that was another way that could entice the younger generation, is by hearing it in a song. But this, I'm not going to sing the song for y'all, but I am going to read you a few of the words that I thought was kind of funny about this song. Copenhagen, it makes me feel so good. Copenhagen, the way I knew it should. Put a little chew in my mouth, go spitting and slobbering all around the house. Copenhagen, it makes me feel so good. Well, it's a cure-all too. Cures fits, warts, freckles, coughs, cold, runny nose. Guaranteed not to rip, run, or snag. Makes conception a wonder and childbirth a pleasure. Now, can you believe there is a country music song with these words in it about a can of snuff? So, obviously they'll come up with anything, but I'm sure the tobacco makers love that song because it really probably boosted their sales. Oral cancer. What is oral cancer? Where does it occur? Who can get it? Oral cancer can occur anywhere in the oral cavity. Your lips, your tongue, the roof of your mouth, the floor of your mouth, the inside of your cheeks, your tonsils, your throat, your voice box, your larynx, even up into your nose and sinuses. Anywhere in the mouth it can occur. And that's why we want to stop the spread of oral cancer and try to get a hold on our patients who are using it so they don't have to deal with this oral cancer or these symptoms. It's like a sore in their mouth that won't go away. Well, if you bite your cheek or eat something hot and burn the roof of your mouth, you know, within a week to 10 days, that sore is going to go away. Sometimes the cheek bite, you keep biting it, makes it worse, makes an ulcer, but you know what it's from. A sore inside the mouth that just won't heal is something that could be oral cancer, and they really need to get it checked out by their dentist. Oral cancer in the oral cavity, it can occur on the lateral borders of the tongue. You can see those white patches. The buccal mucosa, which is the inside of the cheek. That's a common place because a lot of the smokeless tobacco users put it inside their cheek next to their teeth. So inside the buccal mucosa. It can occur on the palate, the roof of the mouth, as well as the throat. It can get into the larynx, into the voice box. There's just so many places that oral cancer can occur. Early detection is the key to survival and results in better outcome. Treatment and early detection could be the difference between life and death. Oral cancer claims the lives of over 10,000 people each year. And of those diagnosed, there's a 5-year survival rate in 60%. It's hard to cure because it spreads so fast. And there have been records of some of the professional athletes, and these are the ones that we hear of because they're professional athletes. They have developed oral cancer within 6 to 7 years of when they began dipping or using smokeless tobacco. So it's fast. It's rapid spreading disease. What are some symptoms of oral cancer? Well, it's a sore that won't go away. Like I told you, if you've had a cheek bite or an ulcer, something hot in the roof of your mouth, you know what it's from, and it's going to go away 7 to 10 days. But oral cancer is a sore that just won't heal. It won't go away. It can be red or white patches. There's pain, tenderness, numbness in the mouth or lips. I have a coworker that she's been having pain in her jaw, and like the other two symptoms, says difficulty in chewing, swallowing, speaking, or moving your tongue or jaw, and a change in your occlusion, which is your bite, the way your teeth fit together. And she's a hygienist. She works with us at the school, and she's been having pain in her jaw, but she can't put her teeth together and on the back, just on the front, end to end. And she is so afraid that it's oral cancer. Not that she uses smokeless tobacco, but she knows the symptoms. She knows what can cause oral cancer. She knows what to look for as a hygienist in her patients. And she told me the other day, she said, I'm just so scared I may have some cancer in my jaw. She said, because it's just really aggravating me with not being able to bite correctly. Who can get oral cancer? Well, like we said, men and women can get oral cancer. No one is excluded. Just because I'm a hygienist, I'm not excluded. I could get oral cancer. Men are twice as likely to get oral cancer than women. Plus, you see more of the men who use the tobacco, the smokeless tobacco, and they're more susceptible. Smokers and excessive alcohol drinkers older than 50, they're more at risk than the teenagers. But anyone can get it. But if you're doing the smokeless tobacco, you're smoking, you're drinking, you're putting yourself at a greater risk. Well, how can we detect it? How do we detect oral cancer? Regular dental exams to begin with. Visit your dentist if you have any sores in your mouth that will not heal, that have been there longer than 2 weeks. Honestly answering questions about your medical and dental history can help the dentist determine any new or unusual symptoms. The main group of people that will not be honest are the teenagers. They're so afraid that the hygienist or the dentist is going to tell their mom or dad that they're using tobacco. You know, if you're a hygienist and you're cleaning their teeth, you can 9 times out of 10 tell if your patient's been smoking or using smokeless tobacco. So they could lie, but we already know. And they know we know. They just don't want us to tell mom and dad because they could get in trouble, because a lot of them are getting it underage. They have to be 18 to buy it, and you'll see 14, 15, 16-year-olds using smokeless tobacco, and you're thinking, well, how did you get it? And I know here in Dodge County, a lot of them can just go in and buy it without getting ID'd, and they can get others to buy it for them. So there is a way, just like kids get a hold of alcohol, there is a way to get this tobacco. Regular dental exams are important to diagnose and prevent oral cancer. The dentist and hygienist are the first way you want to go. You want to visit them on a regular basis. Let them keep a check on your oral cavity. They have records. They keep records of every visit. If they notice something suspicious, they note it. They'll check it the next time and see if it's grown or if it's still there or if it's gone away. They keep records of it. If you have a sore that's been there longer than 2 weeks, call your dentist. Let him look at it. Get a peace of mind. Or if you need a second opinion, he'll send you to an oral surgeon. Let them biopsy it. Anything to get some peace of mind and know that you're not facing cancer. That it could just be just a sore in your mouth that they could easily remove and treat, and instead of you worrying yourself sick over something that could be nothing. But if it is something, they could detect it, get it treated, because it is such a rapid spreading disease. If you just treat it early, you could be cured instead of having to go through a lot of treatments and surgeries. I've had patients who have lost part of their nose and face, even their jawbone. A good friend of my mom's had oral cancer and half of her jawbone was taken out. Her face sunk in. She couldn't even wear dentures because she had to get all her teeth pulled on the bottom, and all she had was half a jawbone. And before she died several years ago, she had gotten this big around, and I know it's from not being able to eat properly and put the nutrients in her body like she should. There are 5 types of oral cancer. There are tumors, which are abnormal cells, benign growths, which are not cancer, precancerous conditions. They're harmless growths, but they can turn into cancer. And cancer, which are tumors that are cancer and can spread throughout the body. And then there are just some other types of cancers that we will talk about. Premalignant lesions. White lesions such as linea alba, leukodemia, frictionally keratosis are common in the oral cavity. These can be identified by your dentist or your hygienist. This is a picture of linea alba. It's this white line that you see on the inside of the cheek. That's kind of where the teeth fit together, the occlusion, and some people will have a pronounced line on the inside of their cheek. Many of our patients, especially in the clinic, they think that they have some type of cancer going on, and it worries them because they're not sure what it is, and we have to reassure them that it's just linea alba. It's very common. Excuse me. Types of benign growths in the oral cavity. There's fibromas. They can be found on the maxilla, which is the upper jaw, or the mandible, which is the lower jaw. Lipoma is between the skin and underlying muscle layer, and it feels doughy. So if your dentist or hygienist were to palpate, or if you were just to feel the inside of your cheek, it may feel kind of like biscuit dough, just real spongy kind of. Papilloma is a growth in the tissue, often known as warts, usually in the top layer of the cells of the skin. And you've heard of the human papilloma virus, which is HPV, and that's a very common sexually transmitted disease. Well, it's in the genitals, starts off like warts in the oral cavity, which you can get HPV in the oral cavity, but you can get papillomas, which looks like warts inside the mouth, and so you can usually detect that when you see the patient, and you can let them know what that is. I think I have a picture of that too. The granular cell tumor occurs under the skin of the head and neck, especially the mouth or tongue. So there's different kind of benign growths that you can detect, the patients can ask you about, and you can put them at ease, let them know what it is, and let them know that it's not cancer, but just to be conscious and be on the lookout for any changes in any of these sores. This is the oral papilloma that I was talking about, and it looks like a wart. It looks just like a wart that, like my daughter's got on her finger, but it's in the mouth. And I'm sure with eating, especially something like chips or something, it probably hits that, makes it more red, makes it sore. So that could cause some issues. There are some precancerous conditions. Leukoplakia is a white or gray patch, and this is the most common among smokeless tobacco users. You will see this in most of them. My husband has some leukoplakia, and we keep watch on it. You want to make sure that if they are using smokeless tobacco, even though you tell them you want them to quit, remind them to move it around. Even though I hate the upper lip dip, I watch my husband when he puts his dip in, and I make sure that he doesn't keep it just on his left side. He moves it to the right. He does put it in the upper, even the lower lip. Move it around. You don't want to put it in the same area day after day after day, all day long. That would really traumatize that tissue. That nicotine's getting into the bloodstream in that one area, and you can really cause the oral cancer to spread fast. The erythroplakia is flat or slightly raised red area, and it bleeds easily. And the erythroleukoplakia is patched with both red and white areas. And I have some pictures of these, so we'll go through and look at these real quick. This is the most common use by smokeless tobacco. It's in the buccal mucosa, which is usually right here on the inside of the cheek, and it's patchy. It almost looks like grooves going through the tissue. It's not flat, it's not smooth like mine, but it's got the grooves in it, and it has it's white, it's lighter. It's where the rest of my husband's tissue may be pink, where this is real pale. It's like white pink. The erythroplakia is flat or slightly raised red area, and it's also commonly used by smokeless tobacco users. And you can see it's more red and raised. There's so many different characteristics of these cancers and what to look for in these signs, but this one is it's more red. It does have some white patches around it. And some types of oral cancer is the squamous cell carcinoma. It's flat scale-like cells, and then the verrucous carcinoma is less than 5% of oral cancers, and it's slow growing. But those are two common types of the oral cancer. This is the squamous cell carcinoma. This is on the left lateral border of the tongue. To me, it looks really, really painful. But you can see the red raised area, and then the grooves on the inside of the tongue. It's also got a coated tongue, almost hairy tongue. And the verrucous carcinoma is raised. It's got the white patch around it. It looks very painful too. And I know if the patients have these kind of sores, they're not able to eat and drink like they should. So I know this is bothering them. And so they will come to you and get checked. and they want you to put them at ease, but the best thing we can do is get them to the oral surgeon, get a biopsy, and start treatment if necessary, or give them peace of mind. There are other types of oral cancer. You have minor salivary gland carcinoma. It's in the lining of the mouth and throat. Lymphomas, tonsils, base of the tongue. It can contain the immune system. The nasopharynx is part of the throat and the nose, and then the larynx is the voice box. So you have all these other types of cancer that start in the oral cavity, but they're really affecting so much more. So when you start affecting the tongue, the tonsils, the throat, there goes your nutrition. You're not able to eat as well. You're not able to fuel your body with what you need. Your voice box, you can get oral cancer starting in the mouth, and it goes to the voice box, and then you're not able to talk. So there's so many other types that seem harmless almost to some people, but it really affects the whole body. Oral cancer affects the entire body, and they're thinking, oh, this is just one thing. This is just one. It may affect one tooth in my mouth, or I can just get a little bit of the palate cut off, get it biopsied, I'll be fine. They're not realizing the long-term effects of what this could be causing. This is the salivary gland carcinoma. When you first glance at it, it's almost like the salivary stone. This is in the Wharton's duct, but you can get it in the Stinson's duct as well. But this would have to be painful right up under the tongue. And, you know, the tongue controls our chewing, our talking, everything. So I'm sure everything would hit this up under the mouth, up under the tongue, in the roof of the mouth, in the floor of the mouth. Lymphomas, this can be in the throat and palate, and these just look like huge red ulcers, very sore. Looks painful to touch. The nasopharynx. When you talk about the nose and the palate, it can go into the sinuses, and I start thinking, well, if it's spreading that fast, what's next? You have your eyes, your brain. So if this can spread from your oral cavity into your nose, then you know it can just spread all over. And this is in the larynx. That just looks just too painful to even talk, but it's white patchy lesion, also a sore in the back of the larynx. So, early signs of cancer, of oral cancer caused by smokeless tobacco. The color, you know, it could be red, white, or gray, a combination of the three. The texture, it can be raised or flat, smooth or rough, thick and nodular, ulcerated, erosion in the tissue. It can just be so many different things. It's not a cookie cutter cancer. It's a wide range of characteristics that it can be. The location, we know, it can be found in the lips, the tongue, the buccal mucosa. The tissue is the fastest healing tissue in the body. If you have a sore that won't heal, get it checked out, please. If it will not heal, if you've had it more than 2 weeks, then that is an early sign of oral cancer, and we need to get it checked. The risk factors, well, like I already told you, nicotine, there's more nicotine in this smokeless tobacco, and it's getting into the bloodstream faster. And a lot of smokeless tobacco users think Well, this is harmless because I'm not smoking, I'm not inhaling, it's not getting into my lungs. But they don't realize that this little pinch of snuff has more nicotine in it and gets into the bloodstream faster by putting it into the mouth next to the tissue. It's absorbing just that quick. The nicotine absorption, which is very addictive, is absorbed at a greater rate into the bloodstream through the tissue by chewing tobacco or snuff. That's scary. Just to know that it can get into the bloodstream that fast. And this is doing more harm to the oral cavity than smokers are facing. They face the issues with the lungs, but they also face the issue with oral cancer, but not like smokeless tobacco users. The oral cancer risk, holding the tobacco in one place for an extended length of time. Like I told you, if you know somebody that's using that just won't quit, at least encourage them to move it around. You don't want to hold it into the tissue, in the mouth, next to the tissue, in one spot all the time. It makes the user more susceptible to oral cancer, as well as gum disease, tooth decay, and tooth loss. So those that are holding it in one place, usually the first thing they get, some recession around these teeth. Then of course they're getting cavities because they're putting this tobacco, which is sweet, has sugars in it, is making cavities on these teeth. Then they're losing those teeth. The gum is receding, the bone is receding as well. So they're just facing all kind of issues if they're not going to at least try to move it around. There's chemical agents in this nicotine, in this smokeless tobacco. Besides nicotine, smokeless tobacco contains cancer-causing agents. There are chemicals like formaldehyde, mercury, which are used in silver fillings, polonium, which is a radioactive material. Formaldehyde, like I said, is in there, and it's a cancer-causing agent. These are dangerous to the body and the cardiovascular system. There was a rumor at one time that glass particles was in Copenhagen, but I did research it, and they said that was not true. But with all these other ingredients, mercury, zinc, formaldehyde, polonium, when I read that there's radioactive material in here, I had a fit. And I told my husband, and of course, he didn't want to believe me. But we're going to still work on that. But it's just amazing what they put in here, and then to know that our younger generation, the high school students and all, are getting addicted to this so quickly, and they're putting these poisons in their mouth. The link between smokeless tobacco use and oral cancer. Smokeless tobacco is used by both men and women. We already discussed that. Older women, back in the day, would use snuff. We went on a visit to a college for my younger daughter, and it was an agricultural college. And on our visit, we went into the cafeteria, and of course everybody had on camouflage and boots, and not judging the agricultural college or way or anything, but there were girls that walked in there with smokeless tobacco in their mouths, and thank goodness it turned my daughter away. because I would have had a fit if I knew she was using smokeless tobacco. But it's just amazing that there were so many kids there using the smokeless tobacco, girls and guys. Smokeless tobacco can be used as chewing tobacco and snuff, like we said, moist and dry. These in the cans are considered moist. The dry are in those cylinder cans, and like I said, that's what a lot of the older generations use. The long-term use can increase the risk in oral cancer. And smokeless tobacco contains, we talked about these ingredients, the polonium, radioactive material, cadmium, which is very similar to mercury and zinc. The agents such as formaldehyde, which is a cancer-causing agent, is known to increase asthma and allergies, and is found in smokeless tobacco. And holding the tobacco against the oral tissue for prolonged periods of time, it can be traumatic to the tissue. It can be traumatic to the oral cavity. It can cause lesions, sores, which lead to oral cancer and can spread. It can spread all over the body. It can start as a simple sore in the mouth and spread rapidly, like we talked about. The nasopharynx. Under the sinuses, I would be scared it would get to the brain eventually. So what do? Well, we educate. We educate our friends, our patients, our husbands. Let them know the dangers of smokeless tobacco and the effects it has on the oral cavity and the entire body. Let them know who is at risk and what the risk factors are. Let them know to be on the lookout for sores in the mouth that just won't heal. Give them some information. You don't have to scare them. You don't have to turn them away. But just let them know that you care and that you want to help them try to quit if possible. The entire body is at risk for cancer from something that's being held in the mouth for hours on end. Nicotine can get into the bloodstream faster through smokeless tobacco than cigarettes, and it's highly addictive. And like I said, my husband is highly addicted to it. I don't know what we're going to do to try to get him to quit, but I've tried so many things and I'm still trying, so it's not a lost cause yet. How do we prevent it? Well, we can help the users quit. There are hotlines. There are tobacco cessation programs that we can help our patients. We can help our friends. We can help our loved ones. We can show them pictures, show them the list of ingredients, make them aware of the dangers of this deadly habit. If they continue this use, they could lose their jawbone, their tissue, their teeth, and even their life. And after all that my husband and I have been through over the last year, I really want him around a long time with me to stick with me on, what we may deal with next, because we sure don't know what tomorrow holds. None of us do. But it would be nice to know that he's as healthy as he could be, and hopefully if I can get him to quit, then I can say I helped save his life, because he is important to me. My patients are important to me, and I want to be able to help them. So we even have programs at our school where we have the tobacco cessation, and we know that we have smokers or smokeless tobacco users, and we hook them up with some very good literature, hotlines. We try to talk to them about quitting or setting a quit date and telling them that we'll be there to talk to them. They'll come back in 2 weeks and we can reevaluate them and we can talk to them again and see how it's going. Let them know they've got a friend on their side and that somebody is there that cares. Alright, we're going to do a post test. Everyone should get 100. But it's going to be the same questions that we did at the beginning, except we're going to do them after having heard this. Maybe you learn a little bit. But it's going to be the same 5 questions. Name 3 uses of smokeless tobacco, which you can dip it, you can use it as snuff, you can use it as chewing tobacco. There are several different uses and several different kinds of smokeless tobacco. 3 places that oral cancer can occur. We know anywhere in the mouth, but the tongue, the lips, the roof of the mouth, the floor of the mouth, inside the cheek, any of those answers would be fine. Who can get oral cancer? Anybody. Me, you, anybody. No one's immune. So, 3 types of oral cancer. We talked about the squamous cell, the verrucous carcinoma, the papilloma, which is the benign cancers, the lipoma, and then like the erythroplakia and leukoplakia, which are benign. And then the risk factors associated with smokeless tobacco. Well, the biggest risk is oral cancer. But we hold it in place, in the same place, and we risk losing our teeth, our jawbone, and eventually our life. So the risk factors are huge. It's a major cancer that you don't hear a lot about in the news. You hear about the lung cancer and pancreatic cancer, all these other cancers, but you don't hear much about the oral cancer in the news. And this is frightening to me, to know that our young people are so susceptible to getting oral cancer because they're starting so young. And if they do start as young as my husband at 9 or 10 years old, as powerful as these ingredients are now, they may not make it to 48 like he is. So just think about it, try to educate, let's try to prevent it. And thank you again for listening. This is just a personal issue with me, and it's meant a lot to me to work on this project, and I appreciate y'all listening, and maybe you learned a little something that you can take away from it. Thank you.